Have you ever thought back to those pivotal moments in your life that looked like a fork in the road? You could have gone either this way or that way. That happened to me when I was 16 years old, and my mother said to me, "Julie, why don't you become a nurse?" She always had wanted to be a nurse. I thought, yeah, that feels right. That really resonated with me even at that young age. Now I look back on that, and it was the best decision I ever made. In my profession as a nurse for over 4 decades now, I've been able to help so many patients. I've worked in critical care areas like the ER, the emergency room, the critical care, the ICU. I spent 10 years on the helicopter as a flight nurse. I remember thinking, I can't believe they pay me to do this job. One New Year's Eve, we were flying over the Las Vegas Strip amongst all the fireworks. Can you imagine that? It was pretty amazing. One of my favorite roles in being a nurse was being a nursing professor and teaching over 10,000 nurses. I really felt like I wanted to make a difference in a bigger scale. And boy, was I able to do that. A key concept that I learned as a nurse and then passed on to my nursing students was that healthcare is both an art and a science. The science is the physiology. When we learned about how the electrolytes like potassium really impacted the heart rhythm, and a high or low potassium level could really create a disturbance in the heart rhythm. The art of nursing and healthcare is what we personally bring to every patient encounter that we have. We lead with our heart, or we can come in not really caring, and it's noticeable. I found that a smile and a touch of the hand could be more powerful than morphine. When I was researching for my doctoral degree, and I learned the shocking fact that medical error is the 3rd leading cause of death, I was stunned. I'd already been a nurse for 25 years. How come I didn't know that? 1 in 4 patients in the healthcare system suffers some kind of harm. Isn't that shocking? If you were to ask the people in your life, your friends, 1 out of 4 would probably say, yeah, something happened to me along those lines. 10 years ago, it was time for my routine colonoscopy. I don't know if you've had fun at that party before, but I was laying there, and as a nurse, I knew all the things that could go wrong in just this simple procedure. I asked the anesthesiologist to please count my breathing rate before he was giving me the medication to go to sleep. And then I happened to look up at the screen, the monitor where they would show my insides with the scope here in just a few minutes, and said, is that supposed to be my name up there? Oh, yeah, aren't you Mary Lopez? And they looked at my armband. I wasn't Mary Lopez. My results would have gone to her. Luckily, they were normal. Charles Bates was a patient that was impacted by medical harm. He had suffered a fall, hit his head, and had a brain bleed. They had to do surgery to evacuate this blood. He came through the surgery just fine. But the following few days, he started complaining of shortness of breath. His respiratory rate was picking up. His oxygen was low. He was complaining of arm numbness and pain in his calf. When he reported this to the doctors and nurses, they didn't seem concerned. Charles continued deteriorating. His condition wasn't stable, and his wife was really concerned. But again, nobody seemed to listen. Charles had developed a blood clot that traveled from his leg to his lung that was causing his symptoms. He also had seizures caused from this. Unfortunately, because the healthcare team did not have a culture of listening to patients and partnering with their families, Charles did not survive. But he could have. Research shows us that one of the most powerful strategies of impacting and improving patient safety is partnering with patients and their families. A two-way conversation where doctors and nurses and the healthcare team listen and the family feels encouraged to speak up and share about their concerns or what's going on with their family member can make the difference between life and death. Imagine if this healthcare team, the doctors and nurses, had listened to Charles and taking his concerns and his symptoms seriously, or his wife, Mrs. Bates, when she said something is wrong. Maybe he would still be alive today. When I taught nursing students, I used the analogy of the continuum. The patient is healthy, and no, we didn't have very many healthy patients. The end of that continuum is the patient is dead. Patients show signs of deterioration up to 6 to 24 hours prior to a cardiac arrest. So every intervention that we do to help the patient, we need to reassess. Is what we did, like giving some IV fluids, helping the patient's dehydration? Is their heart rate still high and their blood pressure too low? Then they're sliding down that continuum and we need to do something further. This is where the family can come in. This is where the family can partner. They can tell us those little nuances when the patient is not themselves or when they're concerned so that we as a healthcare team can intervene early. As Dr. Don Berwick, an icon and a patient safety expert, said, when we shift the healthcare paradigm, when physicians and nurses, the healthcare team, can ask patients instead of, what's the matter with you? We shift to what matters to you. That is when we're engaging the patient and developing this relationship of partnering. This is going to impact patient safety. This is going to create an environment where there's two-way conversations, where we have compassion, where we have empathy, and it's a partnership, a true partnership. Today, the healthcare environment that we work in is fast-paced. It's changing all the time. We have new information, and it can seem chaotic. When we actively listen to our patients and their families with empathy and compassion, and we partner with them, we are going to change the landscape of healthcare and make it a safer place for all of us, because every life matters.